Okay, so what we're going to look at today is counterstraining this area here over the plantar surface of the navicular. So this is a problem area of the foot that people with foot problems, plantar fasciitis or whatever, you'll be looking to treat. And people will often come in here and they'll go, oh, there's a tender point in the plantar fascia in that kind of region. So what we'll do is we'll shorten it by just shortening off the plantar fascia and wait for 90 seconds and release it back off. But the problem is, what you're actually feeling there is the tibialis posterior, as it's coming from the posterior tibia and fibula coming around, and you're actually on a tender point in that. So if you just squeeze it in like that, you're not actually going to get the release. What you actually need to do is grab hold of the navicular and invert the navicular to shorten the tibialis posterior muscle. We bring it around and eventually we get a softening of that point through there. Hold that for 90 seconds and make sure that we're not thinking of the bone and just locking up everything by thinking of the bone, thinking of the muscle. And if we hold that for 90 seconds, we'll get a nice release of that point through there. So that's one example of an area of the foot where if you actually know the anatomy or if you know the technique, you'll get a much better result than if you just make it up. So that's how we counterstrain the plantar surface of the navicular.